Cultural Diversity in the Healthcare Workplace by Patricia Aranda, Vanna Henson, Molly Holland, Melissa Rodriguez, Janina Sells, and Nicole Solok. Learning objectives. We will be defining the following. Cultural diversity. The impact of culture, issues on health, healthcare, and cost. Class standards. AHIMA's Code of Ethics. Breach of healthcare ethics. Americans with Disabilities Act. Titles of ADA. Equal Employment Opportunity Commission. And how we can support cultural diversity. Lesson plans. Here is a list of the topics that will be discussed in our PowerPoint presentation. Define workforce cultural diversity. It is a group of people who work within an organization and are from different cultures and backgrounds. Diversity includes factors such as gender, age, culture, religion, social status, sexual orientation, and personality. Cultural competence. Being able to communicate and interact with people of different cultures. Self-awareness. Knowing about our own culture can help us make better decisions. Assumptions, bias, stereotypes are made typically of an individual's gender, their race, and their sexual preference.
The healthcare facility needs to balance health literacy and cultural competence to effectively treat all patients equally. Providers can perform self-assessments to help grow areas that are lacking in order to achieve patient-centered care for all. Without these assessments, patients could suffer the health risks and have poor outcomes. Patient readmittance to the hospital or emergency rooms are higher for providers who are not able to effectively communicate treatment plans with patients, and putting the patient's health in jeopardy by delaying proper treatment as well as being penalized for each readmission. Facilities that are culturally competent are more likely to offer accurate treatment and overall satisfaction from the patients and their families. The impact of cultural issues on a healthcare facility does not only affect the facility itself financially, but most importantly, the patient's health and their well-being, and cause unnecessary distress in combination to the existing ailment. Patients who are disrespected by the members of the organization are far less likely to return for treatment and are more likely to not recommend the facility to their family or friends, creating a loss of revenue. The facility must demonstrate cultural competence in order to provide life-saving care for all patients in the community, and this means that the facility must effectively respect the diversity of culture. Culturally and linguistically appropriate services, better known as CLASS, is a standard that welcomes diversity and promotes health equality for patients by offering training and education with 4 chapters. These 4 chapters are: number 1, Principal Standard; number 2, Governance, Leadership, and Workforce; number 3, Communication and Language Assistance; and finally number 4, Engagement, Continuous Improvement, and Accountability. Within these chapters are a collection of 15 action steps to help eliminate disparities in healthcare. CLASS offers communication at no cost along with easy-to-read material for everyone.
The last group for the CLAS standards is engagement, continuous improvement, and accountability. Incorporating assessments of an organization's activities that are CLAS related will help to continue the improvement of the organization. Collecting and maintaining demographic data that is accurate and reliable to evaluate the impact, that CLAS is having on an organization, and it will show an accurate outcome of the service delivery. Regular assessment should be conducted of the community's health assets and needs. Using these results to make plans and implementing these services will respond to the diversity of the population in the area. An organization should partner with the community in designing, implementing, and evaluating policies and services in order to make sure it is cultural and linguistic appropriate. CLAS standards should be implemented to the general public. There should be policies, goals, and management accountability that are appropriate to the CLAS and put them into the organization's planning and operations. A conflict and grievance resolution that is appropriate to the culturally and linguistically should be in place. It will help to identify, prevent, and help resolve conflicts and complaints. AHIMA's Code of Ethics is relevant to all AHIMA members, non-members with KM certifications, and students who are enrolled in a program in which they will receive a certificate or a degree that is relevant to the AHIMA's purpose. What is the purpose? The purpose is to improve the quality of healthcare. There are 6 purposes of the AHIMA's Code of Ethics: promoting high standards of HIM practices, summarizing a broad ethical purpose that will reflect the profession's core values, establishes a set of principles which will be used to guide in the actions and decisions, gives a framework for professional behavior and responsibilities when ethical uncertainties arise and professional obligations conflict, gives ethical principles for the general public to hold the HIM professional accountable, as well as mentors individuals who are new to the field on the HIM mission, values, and ethical principles.
AHIMA's Codes of Ethics. CAHIM principles reflect on AHIMA's core values. A HIM professional should be an advocate for the consumer's right for privacy and confidentiality, put the health and welfare of others before the interest of the practice or oneself, always protect the PHI in any form to remain confidential, do not take part in any unethical practices or procedures, and report any practices that are being unethical. Only use technical information for what their purpose is intended for. Recruit and mentor students and colleagues to develop a strong professional workforce. Represent the profession in a positive manner. Breach of healthcare ethics. The healthcare ethics were created to establish boundaries and guidance for the medical profession. It helps create the trust between a medical professional and the patient. When you breach those ethics, it is due to misconduct and/or malpractice. What is professional misconduct and malpractice? Professional misconduct is referred to behavior by a professional that implies an intentional compromise of ethical standards in the healthcare setting. Malpractice. Malpractice is a breach by a medical professional with a standard of care or a standard of conduct. It is negligence or misconduct by a professional staff member like a doctor, nurse, lawyer, biller, or an accountant. Malpractice is when a client or patient is injured or damaged because of error. Breach of healthcare ethics continued. What is the result of professional misconduct and malpractice? Professional misconduct can result in private reprimand or public reprimand. This can lead to termination of employment, suspension of license, or closure of facility. Malpractice. Malpractice can result in compensation for the patient that resulted from negligence from a medical provider. This can also affect the facility with suspension of license to practice and closure of the facility.
Americans with Disabilities Act. What is the ADA? ADA stands for the Americans with Disabilities Act and was signed into law in 1990. The ADA protects people with disabilities from discrimination in public life, such as school, work, transportation, or places that are open to the public. There are titles of the ADA. Title I of the ADA pertains to employment and prohibits employers from discriminating against individuals based on disability. It also requires employers to provide reasonable accommodations to covered individuals. Examples include providing headphones to an employee who works in a loud area, or providing a stool to an employee where they usually stand. Title II of the ADA pertains to public services and states that public entities, meaning state and local government and their departments, are not permitted to exclude qualified individuals from participating in or qualifying for services, programs, or activities due to their disability. Title III pertains to public accommodations and states that public accommodations, meaning privately owned businesses such as hotels, stores, or doctor's offices, are prohibited from discriminating against qualified individuals based on their disability. It also sets the minimum standards on accessibility for commercial facilities and privately owned public accommodations. Title IV of the ADA refers to telecommunications and requires federally funded public service announcements to have closed captioning. It also requires telephone and internet companies to provide services that allow individuals with hearing and speech disabilities to communicate over the phone. Title V of the ADA is the miscellaneous one and details how this law interacts with other laws.
Equal Employment Opportunity Commission. The U.S. Equal Employment Opportunity Commission is also called the EEOC. The EEOC protects people from discrimination within the workforce. Discrimination can be defined by various factors. It can be discrimination by race, color, religion, sex, which can be defined as pregnancy, gender identity, and sexual orientation. Discrimination can also be by national origin, age, as in potential employees that are 40 years or older, disability, and genetic information. Equal Employment Opportunity Commission. The EEOC protects individuals during application, duration of employment, promotion, and if the individual makes a complaint about discrimination, commits discrimination, or is currently in a lawsuit involving discrimination, they are protected as well. The EEOC only covers employment within companies that have 15 or more employees. The EEOC's main goal is to provide education that prevents discrimination from happening in the first place. How can we support cultural diversity? First, we need to provide diversity and inclusion training. Next, we need to acknowledge holidays, festivals, or food from every culture. We also should support spiritual and religious beliefs, as well as provide linguistic support. We should celebrate the different culture days and eliminate prejudice from the workplace. We should always try to include cultural engagement activities so the employees can learn about others' beliefs and customs and learn to respect one another. We have included a short quiz that we have all developed, in order to test your knowledge that you have gained from viewing this presentation. We hope you enjoy.